Hi, my name is David Pozo, and today I'm going to talk about st2 and endothelial injury as a link between GVHD and microangiopathy. Definition: there is an association between elevated levels of st2 protein, a marker of endothelial injury, at the time of diagnosis of graft-versus-host disease, and resistance to glucocorticoid therapy among recipients of hematopoietic stem cell transplantation. Application in medicine. The authors found a strong association between st2 levels at day 14 after transplantation, at point well before onset GVHD, at the rate of death at 6 months among patients without relapse in disease, but the cause of increased mortality was not clear. Pros and cons. It's difficult to say who will be develop GVHD after transplant. We don't know exactly, but somewhere between 1 and 4 out of every 5 people having a donor transplant will be developed some degree of GVHD. The careful evaluation of transplant recipients with glucocorticoid-resistant GVHD for signs of TA-TMA might identify additional therapeutic options. st2 has a considerable prognostic value and is used as an aid for risk stratification in identifying patients who are at high risk of mortality and rehospitalization. Issue apply in Ecuador. No data reports about this case in Ecuador, but in other countries there are a large number of clinical trials in development or recently completed in the area of new treatments of graft-versus-host disease, as well as in its prevention. Conclusion: an elevated st2 level was significantly associated with TA and TMA in all 3 cohorts, a variable that was not reported, and perhaps an important cause of the excess mortality. We address the relationship between TA and TMA and GVHD using a multivariate linear regression in data from recipients of allogenic stem cell transplants. There are treatments to prevent GVHD. Doctors fine-tune they use these treatments. They try to lower the risk of serious GVHD as far as possible, but still keep some benefits of GVHD. Thanks.